Hello and welcome back to my channel. I'm Dr. Karen Lane, and today I'll be taking us through hypertension. Now, what is hypertension? So the International Society of Hypertension and the European Society of Cardiology define hypertension as a systolic blood pressure of 140 millimeters of mercury or greater, and or a diastolic blood pressure of 90 millimeters of mercury and above. Now, what does this mean? When you check your blood pressure, there are usually two figures shown to you. There's one on top and then one below. That's if you're using a digital SFIG or BP monitor. And the one at the top is called the systolic blood pressure. That is the blood pressure in your body when your heart beats or your heart contracts. And then there's the diastolic blood pressure. That is the blood pressure in your body when your heart is relaxed or in between two beats. So that's the systolic blood pressure and then diastolic blood pressure. Systolic is on top and diastolic is below. So when you have your blood pressure checked, you want to look at those two figures. You can ask if the healthcare provider doesn't tell you. If you have your own machine, these are the things you want to be looking out for: the number on top and the number below, the systolic and the diastolic. So with this definition, 140 and 90 are the cutoff points. I must say that the Americans have slightly lower cutoffs, but I will be focusing on the International Society of Hypertension and the European Society of Cardiology definitions for my presentation. And so an example of high blood pressure would be a BP of 140/90. That is high blood pressure. Or 145, which is a high systolic, and then 80. The 80 being the lower number is not at the cutoff for hypertension, but because the systolic blood pressure is high, above 140, we'll still tag that as hypertension. Then in the converse, you could also have a figure like 135/95 or 135/100. So the 135 is lower than the cutoff for hypertension, but will still be considered hypertension because the diastolic blood pressure is elevated, being above 90. Of course, there are factors that could increase somebody's blood pressure at the moment that the blood pressure is being checked. And so there is a bit of consideration and making sure before we give the diagnosis of hypertension, because it has lifelong consequences for the person being diagnosed. For instance, some people are so frightened of this white coat that some doctors choose to wear. I don't wear mine all the time, but I do sometimes, and the white coat can frighten people, and so we have what we call white coat hypertension. They check their blood pressures at home, they are normal. Once they get into the hospital and sit down for it to be checked, the blood pressure shoots up. So with such people who can confirm that their blood pressures at home are lower, there are other forms of monitoring we do, and then we make a diagnosis if need be. Also just physical activity, so walking. So it's encouraged that before you have your blood pressure checked, you've sat down and rested for some minutes before your blood pressure is checked, because if it's checked right after walking into the hospital or rushing, the blood pressure could be unduly high. So how is hypertension diagnosed? Really, there are no symptoms of hypertension itself. There are usually symptoms of its complications. So once complications set in, we call it end organ damage. So hypertension affects all organs in the body in different ways. And sometimes by the time end organ damage has occurred, it is late or it's too late already. And so this is why screening for hypertension is so essential. It costs almost nothing. It's easy to do. It's not invasive. It's not painful. I think that everybody should just have their blood pressure checked, say once a month. It's not hard to do. It's easy. If you have a machine at home yourself, just check it as often as you want. So when you come to the hospital, if you want to know whether you have hypertension, what we would usually do is we will take your medical history. We would find out if anyone in your family has hypertension, such as your parents or first degree relatives, such as a sibling. Then we'll examine you, we'll look into your eyes, we'll listen to your heart, and so on and so forth. Then run some routine labs. And then a very useful investigation when looking at somebody who has or could have hypertension is an electrocardiogram, commonly known as the ECG. So this looks at the electrical activity of the heart, electrocardiogram. Electro is electricity or electrical, and then the cardio refers to the heart, and the gram is like a picture or a scan. So that's taking information about the electrical activity in the heart. And this can be changed or damaged when somebody has hypertension. What causes hypertension? We know the processes that go on when someone has hypertension, but the actual cause of hypertension in many instances is not known. And so we have a funny term in medicine which we call it essential hypertension, which almost means it's almost essential that the person develops hypertension at some point in their life, which is not entirely true, but that's just by the way. Hypertension can also be caused by other medical conditions, notably kidney disease. So there are times when hypertension doesn't develop on its own, in which case we would refer to it as essential or primary hypertension, but then it could be a secondary hypertension as a result of something else. There's also hypertension in pregnancy, which is beyond the scope of this talk. We will discuss that in another video. So once hypertension has developed, then it needs to be managed. And so again, the mainstay and first line management of hypertension is lifestyle modification, diet and exercise changes. For people who are overweight, significant loss in weight has significant improvements on their blood pressure. So if a person loses weight, they can have as high as 5 to 20 millimeters of mercury reduction in their systolic blood pressure, and that is significant. Reduction of alcohol intake, ceasing to smoke, and then reducing salt intake, sodium. So sodium is an element that is contained in salt, the regular salt that we eat. Salt in its chemical formula is sodium chloride. So when we eat salt, we get a lot of sodium, and sodium works to increase the blood pressure in a number of ways. And so one key factor in the management of hypertension is reducing how much salt we eat. Now, I tell my patients that this does not mean go off salt totally. If you don't enjoy your meals, you'll be miserable. So it's essential that you have some flavor to your food, but just reduce the intake. No more than 100 millimoles a day is recommended of salt intake. And then I do recommend balanced meals for micronutrients, potassium and magnesium. They are useful in management of hypertension or high blood pressure. And people talk about food supplements and stuff. You can get them, food supplements, but I think that if you have a balanced diet, you're good to go. And then 30 minutes of daily exercise can result in reduction of the systolic blood pressure between 4 to 9 millimeters of mercury. So if your systolic blood pressure, that's the one at the top, is say 150, and then you exercise 30 minutes a day, you can actually lower your systolic blood pressure just by doing that by about 3 to 9. So instead of it being 150, it could be like 147 or even as low as 141 just by exercising 30 minutes a day. So there's a lot that you can achieve with healthy living, exercise, just brisk walking, and eating a balanced diet, fruits, vegetables, fiber, water, and sticking within a healthy calorie limit. So I will continue that the management of hypertension is augmented with medications when that alone, like the diet and exercise alone, is not sufficient for controlling the blood pressures. Now, once medicines are brought in, it is essential that you take them as prescribed. Too often does it happen that we hear somebody has been on antihypertensives for 5 years, 3 years, 10 years, and they got fed up. They said their blood pressures are normal. Why should they take them anymore? They took a break for 3 days. They took a break for a week. And then the next thing that happened is they had a stroke. It's a devastating, many times irreversible complication of high blood pressures. And so I entreat you that if you do have high blood pressure or hypertension, take your medications as prescribed. Live healthy, walk, eat a balanced diet. But whatever you do not stop taking your medications without talking to your provider. Please, it could save your life. If you are depressed, if you think that the medications are too many, if you have any concerns, get in touch with your healthcare provider. Let them know your challenges. They can work through with you. We have combination medicines. So for people who are taking like 3 pills, everything can be combined into one single pill that you take once a day. So there are ways around it. Okay. So if you have heart failure or diabetes in addition to hypertension, then your medications are quite specialized. Yes, and then it will be even more important that you take them as prescribed. The question I get asked is, Doc, how long will I have to take these medicines for? Is it a month, 2 months? Will I ever stop taking the medications? And the hard news is that generally we would not say hypertension is curable. We would be very cautious saying that, because by the time hypertension is diagnosed, there have been permanent changes that have occurred in the body. However, there are people whose blood pressure is so effectively controlled that as they take their medications, their blood pressures are normal. So you check their blood pressure and it's never high. It's actually below the 140/90 cutoff. But then they are taking their medications every day. Okay. And then there are people whose blood pressure normalizes for 5 years or more, or even begins to drop low. Sometimes this happens with age. So you may have somebody who has been on antihypertensives for 20 years. Now they are 80 years old, and we realize that they're having low blood pressures. For such people, we would maybe reduce the number of medications they are taking or reduce the dosages and monitor. So even if medications are being stepped down, you will be monitored. Most likely you'll have a machine at home and you'll be checking from time to time. It's worth it. It's worth it. I can't stress it enough. I don't want to see preventable strokes in the consulting room. I think all doctors would be glad if we could reduce that to a minimum. And one major risk factor for developing strokes is uncontrolled hypertension. If you have hypertension and your blood pressures are controlled, you are fine, you are good to go. Largely, you will be okay. The problem comes in when the blood pressures are not well controlled. And the only way you will know is by checking your blood pressure. However, there are signs and symptoms that your blood pressure may be not well controlled, and these could be headaches. So if for some reason you are experiencing headaches, if you're pregnant and you're experiencing epigastric pain, that is pain at the top of your tummy, or even heartburns, you may want to have your blood pressure checked. If you develop a nosebleed, you're an adult, you haven't hit your head, you haven't hit your nose, but you suddenly develop a nosebleed and you have hypertension, it may mean that your blood pressure is so high that it's causing problems, and you would want to get to the hospital as soon as possible. If anyone you live with or anyone you know has high blood pressure and develops a seizure, suddenly loses consciousness, it could be the onset of a stroke, and so you want to get that person to hospital as soon as possible. So essentially, this is what I have to say about hypertension for now. If you have questions, please get in touch. My contact details are in the description of this video. You can visit my website at www.newbeginnings.health and fill the contact form. I will get in touch with you and answer any questions you have. Or in summary, hypertension really is a silent disease. It doesn't announce itself. There may not be symptoms of hypertension itself, but then there may be symptoms of end organ damage or its complications. So if you have unexplained headaches, blurry vision, chest pain, you definitely want to get to the hospital and have a checkup. But the ideal thing is that from time to time, just walk into a healthcare facility and have your blood pressure checked. It could save a life. It could save your life. It could save a loved one's life. Share the news, spread the word. Let's help prevent unnecessary deaths. Thank you for listening, and I hope to see you in my next video. If you haven't subscribed to my channel, please do. The more subscribers we get, the more people we reach with health education for free. After a certain threshold, I can do live streams on YouTube. So if you haven't subscribed, I'm encouraging you to click the subscribe button and share this video with as many people as you know. Let's help get the word out there. Thank you.